Hi everybody, my name's Nat. I'm from Children's Nursing Queensland and I'm a nurse and stomal therapist, and I'm here with Associate Professor Bhavesh Patel, and we're here today to talk about some of the expectations with gastrostomies, and we're talking today about surgical gastrostomies. So Dr. Bhavesh, what would you recommend people know before they go through the process of having a surgical gastrostomy?
All right, so I think we need to understand why this is being done in the first place. So a lot of the time there's difficulty with feeding, there's difficulty swallowing, there may be neurological issues. We need to understand exactly what we're getting out of it. Sometimes it's just for water intake because the swallow is bad, sometimes it's for medication, and sometimes it is for full feeding because they're just not getting enough. Now, each of those are going to have different feeding regimes, and I think we need to understand that. What do people need to know is it's a journey. This is not a simple quick fix. It's something that we can do to manage the issues that we're currently faced with, and we're making a bad situation manageable. Obviously, this is not an ideal situation, but it's whatever we can do to keep feeding the child or doing whatever thing that we need to do.
I think Journey describes it very well. It's not just a surgery that you have and then you don't have to do anything on either side of that. There's lots of preparation before, there's lots of sort of ongoing care afterwards. I think normally it's the first 6 months that are really important, because by that point we can then teach families how to manage them a bit more, and they can get a little bit more independent with how they manage those.
So I think that first 6 months is really important, and probably even before that. So there's a whole lot of preparation time that you need, and you need to get your head around a few things. It's going to be a change of lifestyle. There's a lot of maintenance that's required, and so you need to prepare for that.
How do you encourage families before they've had the operation to seek support to make sure that they're prepared going into the surgical process?
So I think there needs to be a proper education plan. So you see what the devices look like, you get to play with them. And for some children who I deal with, some of the autistic children who sometimes they don't like to have this thing, and so they need to be sensitized to it. And so I think there needs to be a full education plan beforehand and just getting used to it.
I think that's a really good point. We have a lot of education that goes in from a nursing point of view beforehand, and part of that is showing families devices, letting them feel what they look like, letting children feel them. But even sometimes, we're lucky enough to have expired stock, so we might be able to put an old button, feeding button into a doll or into a teddy bear, just to sort of demedicalise it and get them used to that process too. Thanks everybody for listening to us today. If you'd like some more information, you're welcome to reach out. You can find us at Children's Nursing Queensland or Better Kids Surgery on all of the socials. Thank you so much.